Hi, this is Dr. Nakatsui. I just want to do a little video on how to correctly apply a procedure mask or surgical mask to the face, just in case some of you don't know. Some of you already know, and that's great, but some of you might not know exactly the best way to apply it, and I think this is a good opportunity to show everybody. Now, there is some controversy as to whether or not we should be wearing these out in public, and when I'm in a store, I actually think it's probably a good idea to wear one. I think that it doesn't stop 100% the risk of transmitting a virus or acquiring the virus, but I think if it reduced it by 20-25% and everybody was doing it, I think this would be very helpful. So I think it's a good idea. Now, I know it is a little uncomfortable wearing them in the store or wearing them out and about, especially if you're the only one wearing it. But now it seems like more and more people are wearing it, and as more and more people wear it, it will become more socially acceptable. So I think that the sooner we start, the better it is, and maybe the sooner we can get out of this whole lockdown situation. So anyway, I wanted to give a little video on how to do this. Now, there are different things, different steps to it. The first step is before you apply a mask, you need to wash your hands because just in case you have the virus on your hands. So what you first would do is you take some hand sanitizer and you would apply this to your hands. You kind of put it in between your fingers and on the dorsum of your hands and on your palms, rub it around, or you can use soap and water for 20 seconds and that's sufficient. Now once you've cleaned your hands adequately, then you'll take your mask. Now the first type of mask I'm going to show you is one of these masks with the ties. This one has 4 ties. It has a white side and a blue side, and it's got a little metal bar at the top. Now the blue side always faces out, so for this mask you want to make sure the blue is facing out and the metal bar is at the top. Usually I bend the bar just a tiny bit, just near the middle of it. Then I apply that to my face and nose, just over the dorsum of my nose, and then tie the top set of ties around the back of my head. And I will usually just push down on that bar just to kind of mold it to the shape of my nose. So once that's done, I will take the bottom of it, pull it down underneath my chin, and then again tie it behind my neck this time. So basically, once this is done, you're good. You're good. So now this is fairly tight on the top near my nose, tight around my chin, and you're good to go. So once you've done this and say you're going to take it off, now it's time to take it off. The best thing to do is you wash your hands first, just in case you have some virus on your hands. Untie the ties. So basically detach. There you go. All ready to throw out. So basically you'd throw that out. And then usually you wash your hands again just to make sure there wasn't any virus on the mask that you came in contact with. Now the other type of mask is the one with the loops. So I'm just going to grab one here. And so this is a mask. It's almost the same thing, but it just has these elastic loops on the side instead of the ties. Again, blue side, white side, and then the bar at the top. So you can apply it to your face and then mold the bar to the shape of your nose. Put one loop around one ear, put the other loop around the other ear, and then pull this down so that it covers your chin. And then you're good to go. Pretty simple. So again, you do want to wash your hands beforehand. I didn't do it this time, but you need to wash your hands before. And then after you remove it, you would also want to wash your hands. So you remove it just by taking the loops and taking it off. Now the one thing I wanted to show you was that some things that people do all the time that probably make it less effective and maybe more likely that you get the virus is that after they've been moving around, touching things, they'll adjust the mask quite a bit. So they'll always be adjusting it, touching it, pushing it. So you want to avoid touching your hands or your skin, anything to areas around your nose, eyes, and mouth. And so when you're playing with it like this and you're moving it, adjusting it, that's not a good thing. And so that's one thing. The other thing that I see sometimes is people wear them like this. So they actually aren't really covering their nose very well. Sometimes it's below even. I think it's just more comfortable that way, so people prefer it. And this just is not effective. So you need to wear this on top of the bridge of your nose, and when you mold this, it really helps, prevents it from moving, and hopefully you'll feel less likely to try to adjust it. So again, wash your hands first, take this off, and you're done with it, and then you can wash your hands as necessary. All right, so that's basically how we put on and take off surgical masks. And hopefully that's helpful for some of you. And I hope you have a great day, and I hope to see you again soon.
From so many options in our city, we are top choice for a reason. Discover why.